Hello guys, welcome back to my channel. It's your girl Adira, and welcome. Happy New Year. If this is your first time coming across this space or this channel, please do well to subscribe, and if you've been my subscriber, welcome again. So this season we're going to be doing something really educative yet interesting, and we're going to be doing a series on women's health basically, and this is something everybody should know, especially women. So we're going to be talking on contraception. So a lot of girls get pregnant at the age of 16, 14, or probably women that are married, they don't want more children, but you see yourself having more. You do not know how to control it. You do know about family planning, but you don't know the particular method to use, or you're in this university or secondary school, high school, and probably stay with your boyfriend and stuff, and you do not want to get pregnant yet. You're not ready for kids, probably with your fiance, but you're not ready for kids, and you do not know the good method of contraception to use. This is what this series is basically about. It's going to be telling you about the different types and methods of contraception and the advantages, disadvantages, and then with this you can know the one you prefer and all that. So you should sit tight and watch this video. There will be something important I will tell you at the end of this video, so do not watch till the end if you do not want to miss it. Believe me, you don't want to miss it. So, how do women get pregnant? Well, that's a very easy answer. When a man and a woman come together, get intimate, have sex, the sperm fertilizes the egg, and this is how pregnancy occurs. So this contraception we're talking about prevents this pregnancy from happening. How does contraception prevent pregnancy from happening? It prevents it from happening by one, keeping the egg and the sperm apart. They're not going to join. It keeps them from coming together. Probably kill the sperm before it gets to the egg, but it stops them from coming together. It prevents ovulation. It makes you not to ovulate, which is stopping the production of the egg. When there is no egg, obviously there's no fertilization, so this is what it does. And also, it stops a fertilized egg from lining on the womb, because definitely the child is supposed to grow in the womb, so it stops this fertilized egg from lining on the walls of the womb, thereby stopping growth. So there is no pregnancy. There are so many methods of contraception. I don't know if these are all to it, but I have 15 here, and we're going to be taking them one after the other. So we have the combined pills, we have the male and female condoms, we have the diaphragm, we have the cap, we have the IUD coil, we have the IUS hormonal coil, we have the permanent contraception method, which is the female vasectomy, female sterilization, and the male sterilization, the injections and the implants. We have the natural family planning method, which everybody is aware of. We have the patch, we have the post-estrogen only pills. In one way or the other, you might have come across all this, including the vagina ring. There are lots, just keep coming one after the other, but this is basically all of them. Yeah. So you might be like, these words are strange, where they come from. Probably you've used these forms of contraception at a point of your life where you just don't know this is what it is. So this video is basically going to be explaining them. So because they are long and it's not something we just have to rush into, we're going to be taking them one after the other. And today we're going to be treating the combined pill. So what are these combined pills? They're commonly known as D pills. These are pills you take every day to prevent pregnancy. You have to take them every day in order to prevent pregnancy, especially from getting pregnant. How do you take them? You take these drugs every single day for 21 days. You do not miss a day. You cannot say, okay, I took it on Monday, I'll take it on Wednesday. No, you have to take it continuously. You have to be generous to it. There's no cheating to it. You have to take it every day for 21 days. And after 7 days, you have to wait for 7 days. After 21 days, you wait for 7 days. During the period of that 7 days, you will notice your bleeding. It's normal, so it's not something to be scared of. So after the 7 days, then you continue. You can't say, okay, I'm still bleeding, let me wait for the bleeding to stop. No, even if the bleeding is still happening after the 7 days, you still have to continue with the pill. And you have to be regular with time. What do I mean being regular with time? If you're taking it in the morning around 10, then you have to take the next one around 10 again in the morning. You cannot take it by 10 in the morning today and then tomorrow by 6 in the evening. It's going to mess it up. So you don't want that. And also, if you're someone that is on drugs for some reason, probably you're sick or something, you should know the kind of drugs you take with this pill, because some of the drugs reduces the effect or the efficiency of these pills. So these combined pills are produced with artificial female hormones, the estrogen and the progesterone. These are hormones that are produced in a female naturally, but the artificial ones are used to make these combined pills. So let's go deeper into these combined pills. So how do these combined pills work? How do they prevent you from getting pregnant? Basically, this pill just stops you from ovulating. It stops the production of egg. Some of them, because there are so many types of these combined pills, some stop you from ovulating, while others thicken the mucus at the neck of the womb, making it difficult for the sperm to penetrate or get into the egg to fertilize it. So this is how it stops you from getting pregnant. And also, it makes the walls of the womb thin. It makes it really thin to prevent any fertilized egg from lining on them, therefore stopping the growth or attachment of the fertilized egg to the womb. So this is how it stops you or prevents you from getting pregnant. There are so many brands of these combined pills, but they are all made of, they all are under 3 types. There are 3 main types with different brands. What are the 3 main types of these combined pills? We have the monophasic, the phasic, and the everyday pill. So, like I said, the monophasic 21-day pill, and the phasic 21-day pill, and then the everyday pill, which is the ED. So I'm taking them one after the other. The monophasic 21-day pill. This is a very common pill. It's a very common combined pill. You take it every single day for 21 days, and then the break, and then starts after the 7-day break. You continue. This type of combined pill, each pill in any pack of this combined pill you're taking has the same amount of hormones in them. They produce the same amount of hormone in them. So that is basically it about this monophasic pill. Example of these brands are the microgynon, the Yasmin, and the Mavalon. So these are the 3 main types. You can see them on the screen, right? The microgynon, the Yasmin, and the Mavalon. So these are the 3 popular, not just the only ones under this, but the popular ones under the monophasic 21-day pill. Then the phasic 21-day pill, the difference between the monophasic and the phasic is the phasic has 2 to 3 sections of this in one pack. This phasic has 2 to 3 sections in one pack, and they are all different colors. And each pill has a different amount of hormone from the other. You see the difference? The microgynon is just every day the same amount of hormone in each pill, and you have to take it generously and all. But this has 2 sections, some 3 sections depending on the brand, and all the hormones in the pills are different. They're not the same amount. And also, this phasic, you have to take them exactly around the same time you take the first one. Like I said earlier, if you take one around 7 p.m. in the evening, then the next day you have to take it around that same 7 p.m. in the evening, because it's the way it's going to work better. That's how it's going to be effective, because there are specific hours these drugs are supposed to last to prevent pregnancy. If you do not take them the way they are meant to be, then you're your own, my sister. If anything happens, you do yourself. So you have to take them generously, and you do not cheat, because especially these phasic pills, since they are not having the same amount of hormones in each of them, You cannot miss it, because probably you take Monday and then the one of Tuesday has a better or a bigger amount of hormone to them, and then you skip it, and then you take Wednesday, which has a lower, and but this is going to, number one, that is drug abuse, and you're not going to get what you want. Number two, which is not what you want. You want not to get pregnant. So if you do not take it generously, then you shouldn't even use it at all. If you know you're not going to be generous with it, why use it? Anyway, just saying though. So a brand example of this passive pill is the Loganon. That is an example of this passive pill. And then, last but not the least, have the everyday pill, which is ED. This one is way different from the other two. This one you have to take them every day, like the name is the everyday pill. You have to take them every day, continuously. It has two sections in the pack. One is called the active and the other is the inactive, or the dummy pills. So the active pills are to be taken every single day for 28 days, and then immediately continue with the next section, which are the inactive. There is no stop. You have to take them every day. Even when it finishes, you start the next pack immediately. You don't have to wait. You don't have to skip. You have to take them immediately. You understand? No cheating. No waiting for 7 days to bleed. No. Even if you're having a bleed or you're seeing your menses, you have to continue. You do not have to stop. So that's how this goes. And I want you to take note that you should take these pills according to the brand instructions. If the brand says take it every morning, then you should do it every morning, because they have a reason for doing that. So when you buy any of these contraceptives in this method of contraception, you have to take them according to the brand instruction. Very important. Don't forget. So, another important question about this combined pill. Who can take this pill? I mean, you could easily say it's just a contraception, everybody can take it. No, not everybody can take this. Age-wise, no. 16 years can take it, yes. From 16 years can take these pills, but there are some conditions that can stop you from taking this pill. If you're someone that smokes, if you're a lady and you smoke, you're not permitted to take this pill, or you just stopped smoking like a year ago, you cannot take this pill. If you have gallbladder disease or any liver disease, you're not permitted to take this method of this contraceptives or contraception. You're not permitted to take them. If you're someone that has blood clots, you're not permitted to take it. Or if any member of your family, like a close family member, has blood clot under the age of 45, then you're not permitted to take it. What I mean, a close family member, like your cousin, your mother, sister, aunt, uncle, has a blood clot, you're not permitted to take this drug. Remember, under the age of 45, then you're not permitted to take this drug. If you're having severe migraines, you're not permitted to take it. If you are having complicated diabetes, you should not take this. If you've been having diabetes for the past 20 years, you're not permitted to take this. If you're pregnant, you're not permitted to take this contraceptives. And also, if you have stroke or heart stroke or anything that has to do with the nerve, like any disease or sickness that has to do with the nerve, you're not permitted to take this. So for those that just had a miscarriage or an abortion, you can take it after 5 days of the ordeal. If you lost the pregnancy after 5 days, you miscarried after 5 days, or you aborted after 5 days, you should start taking these pills to prevent the next pregnancy if you're not ready to get pregnant again. Obviously, if you just aborted, then obviously you wouldn't want to get pregnant again. But if you just miscarried and you're not ready, probably because of the shock or the trauma, then you should start 5 days immediately after the ordeal or the miscarriage or the abortion. You should start immediately after 5 days to start taking these pills. And if you've waited a day or 2 days before, let's say after 5 days, you're like, okay, I'll start next tomorrow. Let's say you missed 1 day after 5 days and start taking the pill, then you have to join another form of contraception to it. Probably you start using the condom to it till after 7 days of taking the pill, then you can stop the other method and continue with the pill so that you're safe. If not, there's a very huge chance you're going to get pregnant again, and that is definitely not what you want. So for women that just gave birth, you can continue after 6 weeks of giving birth, but it is very advisable to meet your doctor first before taking that decision, whether you're breastfeeding or not, whether you're lactating mother or not. You should meet your doctor first of all before you start taking these pills. So everything in this life has advantage and disadvantage. And before I go to the advantage and disadvantages, I want you to note that if you vomit this, let's say you take it today and then you throw it up, you puke, for some reason, I think it's best to pick another because that one has gone. So you have to take another, so it's going to do its job. Or you have severe diarrhea, it's going to leave your system, so you're advised to take another one. So now to the advantage and disadvantages of this combined pills. The advantages: it does not interrupt sex. You can have sex anytime you want, morning, afternoon, evening, as long as you're on this pill, you're safe. Two, the second advantage is it reduces the PMS, pre-menstrual syndrome in ladies, like the headache, the mood swings, the tender breasts, the bloating, the anger, like you just feel like you're just upset. You know, all those things that comes with period, it reduces them and you're good to go when you're taking them. It also helps reduce menstrual pain, and it also helps your flow to be lighter. And also another advantage of this pill is reduce the risks of ovarian cancer, colon cancer, and so still on the advantages, it could prevent pelvic inflammatory diseases and also the risk of getting fibroid. It reduces them. So for the disadvantages of these combined pills, it has been linked to serious health conditions such as blood clot and breast cancer. It does not prevent STDs, any type of sexually transmitted disease. It does not prevent it, so you're prone to getting any sexually transmitted disease even when you're on these pills. It increases the blood pressure. So if you're someone that has high blood pressure, you should probably think twice before using this form of contraception, but it increases blood pressure, and also it causes blood breakthrough. Like you could just stay and you notice you're bleeding or spotting of blood and all that. For some months or a few days, it is common when you just start using this form of contraception. So it's not something you should be very scared about, but if you do not want that, probably you should consider using a different method of contraception. And also it brings other symptoms, like when you're using it, some of the side effects, tenderness of the breast, bloating, mood swings, abdominal cramp, and all that. So this is basically the disadvantages of these combined pills. So if you have any question on this combined pill or this form of contraception, if you want to know more about it, if you've used it before and you want to share your experience on it, you want to advise people against something about it, you want to bring us to the light of some of the things you noticed while using this form or method of contraception, then you could do well by telling us down in the comment section, and I will definitely reply. You could email me at sachima51@gmail.com. You can still chat me up on Instagram at audira._, and tell us everything you know about this, when you were using it, how you felt about it. Or if you have any question on this form of contraception, you can still tell us down in the comment section, and I promise to answer. If you want me to go deeper in this combined pills, if you want me to tell you more things about it, if you want me to teach you how to take it based on your menstrual cycle, you can still tell me down in the comment section. I'll definitely do another video to explain more on it and tell you more on everything you want to know about it. Or you can email me and I'll also do another video and I'll explain more on this, because there are a lot on it, but these are the basic things you need to know about it. So if there are more things you want to know about it, do tell me down in the comment section and I'll make another video. Or you can email me, like I said, at sachima51@gmail.com. You can also chat me up on Instagram at audira._. So one more thing you need to know about this form of contraception: if you are 30 years and above, then you should not take this pill. You're not permitted to take combined pills. This is for people that are below the age of 35. So if you're 35 years and above, then this method is not for you. no, 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 this method is not for you. Definitely not for you. So there are other methods that could suit you or fit into your age, and you would want to know them when I release another video. So for you to not miss it out, you should subscribe now. Hit that subscribe button. Hit it. Now you have to just subscribe and then click on the notification bell and click on all, so that when I drop the next video of for the other form of contraception, you would get it immediately. You'll be notified and you could come and watch. Do good to share this with your friends, your colleagues, anybody that you know that deserves to know more on this morbidity kit, and they don't know the risks and the disadvantages, or anything you just saw here that you feel they should know about and they don't know about it. So do good to share it with them, and I'll be very happy to see you on my next video. Have a wonderful week ahead, and bye.